Hey, so with me today is the CEO of the American Liver Foundation, Lorraine Stiehl. Lorraine, welcome.
Thank you, Mike. It's a pleasure to be here.
It's great to have you. Now, Lorraine, you and I have known each other for about, I think, 15 years now, and in that time, I know for sure you are not one to often to talk about yourself and your accomplishments. But that's where I want to start today's conversation, because I think your background is unique in terms of people who have advocacy experience. So you have invested over 30 years of your career as an executive, as a consultant, as a volunteer, and I know most importantly for you as wife of Chris, helping patients with chronic diseases, their families, and their providers. And you've done all of this as both a fundraiser and a national advocacy volunteer. And please correct me if I'm wrong, as far as I'm aware, you're still the only person in the history of the Juvenile Diabetes Research Foundation, or now called JDRF, to have gotten both Staff of the Year honors for your fundraising activities and also National Volunteer of the Year for your advocacy work. And so to me, this amazing background that has gotten you so invested in both of these major aspects of nonprofit operations, right? Both fundraising and advocacy. I wanted you to start just by talking about how that came to be and how you got such deep experience in both aspects.
Well, thank you, Mike. And it's great that you shared some of those special times in my life. I always had an interest in the political world and advocacy, even at a young age. And then when I became involved in the a national nonprofit, to me, it was a partnership between, nonprofit charity and the federal government, because let's face it, a nonprofit can't solve a problem, cure a disease, if it doesn't have that partnership between the federal government, even state governments, and then the charity themselves. So that partnership has been something that has driven me through my entire career in advocacy and nonprofit. I left nonprofit for a while to work at an academic medicine at a prominent academic center. And even there, it was so important to talk advocacy, to engage medical professionals about the role they can play for their patients. Through that effort, through working with clinical trials, working with the NIH and the FDA on clinical trials, I had the most amazing opportunity to be appointed by the Health and Human Services Secretary to serve on the National Institutes of Health, the National Institute of Diabetes, Digestive, and Kidney Disease. It was a 4-year appointment. I was so proud to be able to represent the diabetes community on that committee. But while I was on that committee, I started to hear what was happening in liver and how much needed to happen in liver in terms of advocacy, public awareness. And the need was so great that through that NIDDK volunteer role, I ended up serving first as a volunteer for the American Liver Foundation, then as a consultant. And then when COVID hit, I was asked to serve as CEO of this organization. So my ongoing passion of over 30 years in advocacy has really taken me many places, including the current role I'm in, which is CEO of the American Liver Foundation.
And so that marriage that you mentioned there in your experience in the disease group world for chronic diseases between the federal government and fundraising. It actually is the nexus for the question for today. And today's question, which again, you are probably the most well-positioned person in the nonprofit world to answer, is how can advocacy support a nonprofit organization's fundraising activities?
I am delighted that you've asked me that question, Mike, because a lot of people are afraid of fundraising. They're just, asking somebody to give up dollars, their personal wealth,
Yep.
is very difficult. I have always viewed fundraising as an opportunity to give people a chance to make a difference, to really do well for others, to help a patient community, to help a cause. And so, for me, it is all about providing opportunity for people to give back, for people to engage. Now, engage is the key word here. You want to give individuals, potential donors, current donors, the opportunity to engage. It could be getting involved in a walk. It could be, getting involved with a board of directors. But I would suggest the best way is to engage potential and current donors in advocacy. There is such a thrill when you are so passionate about a cause that you can go to your member of Congress and ask them to support with federal dollars, or get involved in a state issue and encourage state or local officials to get involved in your cause. You have a role to educate. And by educating, by asking, these legislators to do something for your cause, you as the donor just end up being so much more engaged. And I have seen that over and over. Some of the biggest gifts I have ever received in all my years of nonprofit came from dedicated, passionate advocates, people who shared their stories on Capitol Hill, who shared their stories at state government level and state capitals, and who shared their stories locally. And when you get invested, trust me, fundraising dollars will follow. So I just think it's the best way to engage donors and potential donors in your cause. Give them a role in advocacy.
Yeah, that's I think exactly right. And I know when you and I both worked at JDRF, and you having been on both sides of the fundraising and advocacy fence with JDRF and me within advocacy, I know there was always that, yes, we didn't have the, to your point, right? We didn't have the additional pressure of having to ask for money, but setting out a communications plan and having issues that would, to your point, engage people, creating that environment of just a great experience of getting to work with the JDRF staff, getting to work with fellow volunteers. So we're helping them not only make connections to issues, but I think probably just as important, right? You're making connections to other people within the organization who are all just as passionate. So it's like, I always used to tell the other fundraisers at JDRF, like, yes, we're not directly asking for money, you are, but I viewed my job and my role within the advocacy world to create an environment to deliver an experience for someone that was so good that when the follow-up eventually came from that fundraiser, probably at their local chapter, the experience that they had with advocacy was going to be hopefully a determining factor in their willingness to make that donation. And then I think we kind of got a little, I think, a 2-for-1 deal from a fundraising standpoint, because our issues were so tied to government research funding. they were helping us essentially directly raise additional money for research that we wanted to fund. And then, of course, they're also interested in making more interested in making a private donation to fund our efforts, right? So I always felt like our efforts were multiplying our fundraising potential. There
Yep.
a couple times.
There was there was huge leveraging. And we
Right.
always used to say when we worked together in diabetes that, you know, we want to cure type 1 diabetes, but it's really our partnership with the federal government that's going to cure diabetes. That partnership is so important. And so that leveraging of public dollars or private dollars
Right.
for the and leveraging it publicly, I think is really very important.
Yeah, and you mentioned the key term there, the partnership aspect of it, which happened to be a message that resonated not only with the volunteers, but I know in the legislators that we engaged with in Congress, that partnership message, whether you were a Democrat, a Republican, or an independent, that resonated as well, right? I mean, we were an organization that had a plan, we had an approach. Here was our path to what we viewed as a cure, and we wanted the federal government to help do their part, right? So it was always that partnership message. I feel that always got us over the hump in terms of our legislative goals.
Absolutely.
Yeah,
Um, it really is that partnership. And, you know, so many voluntary health agencies and nonprofit charities, you know, they're doing great things in education. They're doing great things in public awareness of their diseases. They're doing great things in research, patient services. But the one piece that really takes you know, a bigger, broader look is advocacy and what the federal government, state government, and local governments can do for patients. And we play an important role there in influencing others. It's not just what we can do as an organization, but what we can do to influence federal dollars. Because let's face it, there's a lot of federal, state, and local dollars out there.
yep. Well, that's the perfect way to end the conversation. Lorraine, thank you again for taking the time to talk today.
Thank you so much, Mike. I'm so grateful for this opportunity, and I think what you're doing is so important. Advocacy is a great passion of mine, as everybody can probably see, and I know it is yours too, Mike. And in the end, it's so important that all causes, all organizations embrace this important area. Thank you.
Thank you, Lorraine.